The Board of Healthcare Funders has applied to the High Court in Pretoria to overturn the moratorium that prohibits medical schemes from providing low-cost benefit options to members of the public who cannot afford full medical scheme membership. For more on this, we're joined by the Managing Director of the BHF, Dr. Katlego Mothudi. Dr. Mothudi, good evening to you. Thanks for your time. Firstly, why are you taking this matter to court?
Good evening, Kathy, and thanks for having us. The step to go to court is purely out of frustration. You will be aware that just over 7 years ago, we went through a process where schemes lodged complaints around primary care products that were not being offered through the Medical Schemes Act. And it was declared at that time through the demarcation regulations that no entity other than a medical scheme should conduct the business of medical scheme. However, there was a latitude given to the providers of the policies through a process that was going to be conducted by the Council for Medical Schemes to ensure that a framework is put into place so that the policyholders could then be transferred after a period of 2 years to the medical schemes. 7 years on, despite various interventions by the schemes, which includes participation on various advisory committees, submission of proposals, etc., to the schemes, this is not concluded. And the last straw, Kathy, was earlier this year when the council extended the exemption period for another 2 years, which meant that schemes could not participate in the process for a longer period still.
What difference will allowing medical schemes to provide low-cost benefit options make? What difference will it have on the healthcare sector?
The first issue is that of access, Kathy. Firstly, the schemes, you would be aware, that have always had this barrier to entry of cost. The cheapest option for a single member is around 1,000 rand, which is unaffordable to even members who are on schemes and prohibitive for people who are not registered on schemes, even those who are employed. Now, lifting the moratorium would allow schemes to establish options that can be better priced, and they provide largely primary care benefits, and that will increase benefits. The scheme environment currently caters for about just under 9 million beneficiaries for access to private health care. There are estimates that there's anything between 10 and 20 million people who could afford these products, who could then gain access. And the reason is we are aware that the state is overburdened. Looking after about 51 million beneficiaries, you hear all sorts of stories that are not comfortable in terms of access that cannot be provided. And we think that medical schemes and the private healthcare sector are a credible partner to the state to provide access to members.
What do you want the court to do?
What we have prayed for, Kathy, is that there should be a lifting of the moratorium. Currently, it's almost like a closed user group of a few insurers who are able to offer these products. We are aware that the council is still working on the framework, although we believe that it should have been published a while ago. But we would like the current moratorium that prohibits schemes to participate to be lifted. Secondly, that the framework be completed, and we have prayed that even if the court finds in our favor, that there should be a grace period of about 12 months to allow the CMS to complete this process so that there is no prejudice to the current policyholders and they should not be denied access.
All right, Dr. Katlego Mothudi, the Managing Director, Board of Healthcare Funders.